Welcome to the 157th episode of the Jami Dulaney Plant-Based Wellness Podcast. My name is Jami Dulaney, and I'm your host. I'm a plant-based cardiologist and endurance athlete living in Southwest Florida. However, I am talking today with Addie Majnaric, my registered dietitian and daughter, with the conference that we just attended in West Virginia, which is both of our alma maters at West Virginia University, and it was the West Virginia Academy of Nutrition and Dietetics. So welcome, Addie, and it was a pleasure doing our first conference together.
Yeah, it was fantastic. So we had a good time up north, even though it was a little bit colder than either of us Southerners were ready for.
Yeah, who would think it would snow in April, and we do have the pictures to prove it. I guess for starters, when we first got to, we talked all the time about traveling and eating plant-based. And when we got to West Virginia, one of the first things that we did was we went to the local grocery store, Kroger's, and we loaded up on fruit for our hotel room. The hotel had oatmeal for breakfast, but we wanted to make sure our room had plenty of fruit, so that's what we did. So we're stocked up there. So that's always a good thing. And when we went to the conference, it was actually held at a Marriott, large Marriott hotel called the Waterfront. And we were the only two getting plant-based lunches. So that was interesting. Unfortunately, but the good thing about the conference, as far as I guess we start with food. That's not necessarily the best thing to start with, but the theme of the food that they provided was locally sourced food. So that was very interesting to be able to have local food. I think that's very important. And the whole theme of the conference was, how to take care of West Virginians better, and how to, there's a significant hunger problem and food desert problem in a lot of parts of West Virginia. And, big shout out to Megan Govindan, who was the coordinator of this program, for all that she's doing to help West Virginians in this problem. But one of the first things, that really touched us was a presentation by Senator John Unger. And, again, I always think about, and it was just recently published in the Journal of American Medical Association, of the obesity crisis and actually the lifespan decreasing in areas, particularly West Virginia, Kentucky, Mississippi. And we think of it because of lifestyle diseases and obesity. And that's actually what I was there to talk about, was the reversal of lifestyle diseases through plant-based nutrition. But Senator Unger actually got up and he was talking about a whole nother topic, and that was hunger, and it shocked me bad. He told the story of going to a third grade school, presenting to a third grade class in a public school in West Virginia, and he was going to teach them how to get a bill through Congress. And so he wanted two bills to debate, and so one kid picked, how about we have an extra recess, and another kid suggested, how about we have a second lunch. And so he wanted them to debate why you should have each one, and they talked about recess and so forth, and why they might want each one. And one little boy finally raised his hand, and he said that he wanted a second lunch so he could give his food to his brother at night, so he wouldn't be hungry. So that pretty much got everybody in the room.
Yeah, very choked up. I don't think there was a dry eye in the room, and a lot of the dietitians in the room, we had several who were either in pediatric nutrition facilities or school nutrition dietitians who, were well aware of these issues. And it's not just in West Virginia, it's in many states across our country. And it's very sad, but it's also, an opportunity that we can, again, as healthcare providers, have some influence on, but that we all can. And it was just pretty wild, though, to hear about. You don't think, just general population of people in the U.S., you don't think of, kids going hungry, but it's real, and it's not just lack of money. It's also lack of resources within, West Virginia and Appalachia in general is these things we define as food deserts. So, if you don't have a car and the local grocery store is 2 hours away, you don't have access as of now to those healthier foods, if foods at all. So people are going to gas stations to buy meals for their family. And so it's pretty daunting to think about. I live literally a mile from a Publix. But to think about having to travel that far, transporting produce and, for those who aren't plant-based, other perishable items, these food deserts are real and they're affecting, the nourishment of our future, which is the kids.
So what he is actually doing is trying to get free lunches for every kid because, the point well taken that children's brains develop and they need adequate nutrition to learn. And so if we're going to, as a country, provide the opportunity for free education for all children, then we need to provide them the opportunity to eat so they can nourish their brain and learn. Food is every bit as much of learning as pens and pencils and papers when it comes down to it. And so not to have kids shamed or turned away at the food line, that he wants to try to make sure that every kid has access to food, not only during the school year, but in the summer. And he also talked about programs where retired people come in and, perhaps read to the children during the day, during lunch, so they can kind of get an idea of what's going on in the home and how we can better serve these kids. So, I thought it was very admirable, in this day, in this climate of politicians, and we blame, both parties for whatever. I was most taken back by his compassion to actually, go into the communities and help people
and make a difference
and make a difference. So it was really good. The other thing that we learned on the similar line, there was a woman from Pittsburgh that created an app called 412 Food Rescue, and similar again, inner cities. And it's funny, I did my residency and fellowship in the University of Pittsburgh. And when I was there, I would get teased about being from West Virginia. And I would get teased to a point that I would eventually lash back. And, they would, make comments about, you hillbillies, you have your refrigerator on the front porch, or, you live in the boonies or whatever. And I made the comment to them that, our poor is no different from city poor. It's where we live. It may be in the country versus in the inner city, but poor people are poor people. And they all need our help. And this woman, drove that home as well because, people living in high-rises and low-income housing don't have cars, can't get to the grocery store, can't get to where the food is. And we also have grocery stores that are throwing away food if it's marked incorrectly, if it has a blemish on it. So we have this food that's going to waste and these people that desperately need produce because we can't heal America with, box foods and powdered potatoes and Cheerios. We need to give them, whole foods, plants, vegetables, and fruit, and we need to get greens to them. And this is a way of doing that. So she created this app that's kind of like an Uber app that if a grocery store has food and it's within a 5-mile radius, they contact a person that's, signed up to be a driver, and they actually deliver the food to the source, so to the apartment complex or the church or the daycare or wherever this produce could be used, and it is connected. And so she's it's going on Pittsburgh. It's been very successful. It's cost effective. People are actually getting helped, and she's now starting to open it up into other cities. So I'd encourage anybody that's listening to this podcast, download this app 412 Food Rescue because it could be coming to a city near you soon. And certainly if you live in the greater Pittsburgh area and you would like to be really instrumental in helping other people, it's a great thing. I would like our membership to eventually get involved in something like this so we could kind of get back to the community, but I think it's a wonderful idea.
Yeah, I thought what was cool too was, one of the dietitians raised their hand and asked, what was the demographic of people getting involved in this. And I thought it was pretty cool that she said mostly it was moms, some stay-at-home moms that are, raising their kids and using it as a tool to show their kids what giving back looks like, and how easily it is to get involved in your community. So, it can turn into a family event, and a way to make volunteering a little less complicated. For some people, you're going and transporting food, nourishment to other people. How much more can you give back to the community?
Yeah, I mean, it would be a great thing for service hours for kids. I mean, learn about food, learn about produce, learn about helping others. So that's a great thing. We also heard from a registered dietitian at Tulane University that they've actually developed a program to allow third and fourth year medical students to rotate through and learn about the Mediterranean diet. So although, the Mediterranean diet is better than the regular standard American diet, at least medical students are learning on how to cook and, how to approach their patients as far as questioning about, their diet. We're taught that, the first line therapy for blood pressure and cholesterol is to eat healthy and exercise. And that's pretty much the only sentence that's used, when talking to patients by most physicians, is you should eat healthy and exercise. And, nobody really knows what that is. And, 25, 30-year-old medical student residents, probably don't know much about cooking in the first place in a lot of instances. And, that was another thing that we saw when we went back home to the town I grew up in, Morgantown, West Virginia. When I was there, it was 20,000 students and 20,000 people, so it was a relatively small town with a few fast food restaurants. Now there's high-rise buildings to support 50,000 students all over the place, and every high-rise has a gym, but they also have 3 or 4 chain restaurants in it. So, a college student may never, ever learn to cook or do anything for themselves with regard to nutrition. They can eat fast foods 24/7, whether it be in a dorm, at the student union, or right there in their apartment building. So you can just see that what we are creating, probably even more and more obese students by the fact that, this stuff is worse than, I would guess a regular college, cafeteria program. At least, some of those are, transitioning to more healthy foods. But, this really is throwing fast, processed, high salt, high fat food at students everywhere they look. And it's just a recipe for disaster as well.
Mm-hmm.
So, but it was a very informative meeting. When we looked, I circled back to the buffet table at lunchtime. Addie and I were the only two that got a plant-based meal, and nobody made fun of us for that, so that was good. But people, just like doctors, don't think about their own health or their own medication, taking medications. It was apparent that registered dietitians don't necessarily think about their own health. And, they teach others to eat healthy, but, obviously not necally eating healthy themselves. The Marriott messed up as far as there wasn't any fruit. It was supposed to be pears and apples from local farms in West Virginia and Maryland, and they dropped the ball. But nobody was really upset about that. And part of that is, because how we present fruit as being like a second-tier dessert, or if you just, if you have ever noticed in a hotel or wherever, if they put just a banana in its peel or an orange or an apple, nobody really, it's kind of overlooked. But if there's fruit salad and cut up and, things are nicely presented, and apples are sliced and, there's a tray, there's more like a veggie tray, but a fruit tray, people are much more likely to take some because it looks better. And obviously you could serve some type of dip if you wanted to that could be actually potentially healthy. But the Marriott also messed up, some desserts, and they put like a cheesecake and some other sugary things on there, but it didn't really, nobody was too upset about it. And we noticed it. It was kind of, overlooked. But it's just so much the norm that, we forget that every time we eat something, we either have the chance to heal ourselves or to make ourselves more sick. And, it's only if you demand a certain quality that you're going to get it. And, I'm sure without any hesitation that the Marriott chefs could have been instructed and have their feet held to the fire to come up with, a healthier fare. But that's, something to look into for the future. Because, we had your wedding at the university, but the chefs there they did a fabulous spread for us that was all plant-based.
Right. I will say, though, just to kind of end, with a positive note, I did think that it was great that both days, the entire meals that were presented were from local farms. So it wasn't big farms or big, Cisco outreach sources. They were local farms, which was kind of perfectly led into the second day when they had the panel of farm to table and getting to know your farmer. And, a big theme of the conference was getting back to knowing where your food comes from. So there were definitely areas for improvement, which were very apparent to you and I. And, like you said, we kind of chuckled that, we were the only ones to seem to notice it, which was odd, considering the room that we were filled in. But it was very cool to experience that, local produce that, was coming from a local family farm. So I thought that was pretty cool that a whole state's dietetic conference was based off of that.
Yeah, that was actually fabulous. And, there's nothing better than locally grown produce. And it comes back to, again, the influence of the, ag and dairy. And it was, it was not something that anybody was ashamed from, that the Dairy Council was a big sponsor, of the Academy of Nutrition and Dietetics, as it is all over the United States. And that's a bit of a huge problem. The other thing that, I think is not yet apparent to, a lot of people, most people, is this thing of moderation. Registered dietitians are, I got to say, they're a nice group of people. And they desperately want to help people, and they desperately don't want to offend anybody. And, by this moderation, let's rein things in a little bit. The reality of it is not doing anybody any favors, but that's what everybody is taught. We'll just rein this in. We'll take what people are doing and try to make it a little bit better. And so my presentation on reversing lifestyle diseases through plant-based nutrition was, a bit of a shock. But I want to take my hat off to registered dietitians everywhere. I think that they hold the key to making society a healthier, making us all healthier. And can do the greatest good because they can actually get to people before there's disease, and they can certainly turn back. But it needs to be a partnership with registered dietitians and physicians. And, we need to listen to registered dietitians. We need to give them the freedom to educate our patient. And then we also need to be available to respond by getting these medications off. But, they were very receptive to plant-based nutrition, and I think they were very receptive to the data that I showed them on how our patients are able to come off insulin. We showed 5 or 6 different examples of patients that we've had in this, last several months. To the last several years, they're just, I took a scattering of our patients, and they went from having chest pain to not having chest pain, to being on 80 units of insulin, to being on 0 units of insulin, to having diabetic neuropathy go away, to having claudication go away. So, all this is possible, but it's not possible with moderation. It's only possible with a whole food plant-based diet. And so I think, I think we made people think, and it was positive. I certainly enjoyed everybody's company that I was exposed to. And, there's nothing better than going home to good old West Virginia.
No, definitely not.
To continue our discussion, the conference, really, really enjoyed it. And they had a couple panels, and the one panel, it was, for the most part, a day in the life of the registered dietitian, because there's so many different facets of registered dietitians. And I think, first and foremost, I know, Addie, this is near and dear to your heart. I would like you to, let's just go over a registered dietitian versus somebody that calls themselves a nutritionist or takes a conference on healthy eating for a weekend. There's a huge difference in what you go through versus somebody that does a nutrition course. So let's just define a registered dietitian for starters.
Sure. So, yeah, there's a huge difference. And while, I'll start with the positive, anybody who wants to get in the field of health and wellness, obviously we're hoping that they're doing it to promote, a better lifestyle for their communities and people they're involved with, their clients. So while all intentions we're hoping might be noble, there is a time and a place for, the educated professionals who have taken time to specialize in the area of nutrition, as well as, nutritionist medicine, and dealing directly with clients who are trying to change their lifestyle, who may, have kids, families, health conditions. You really need to seek out an expert in that field. And unfortunately, nutrition has more components to it than what's on your plate. As dietitians, we are taught the, broad yet in-depth facets of science and biochemistry and organic chemistry and anatomy and the body processes, and how your metabolism works on an organic, very cellular level. And we're taught all of that in depth so that then we can make it simple for you and give you the best advice and clinical diagnosis and direction in the area of nutrition and dietetics as possible. All of which, so to become a registered dietitian, at this point in time, you need a Bachelor of Science degree in Human Nutrition and Foods from a certified didactic program. And not every program is certified, so you have to go through a bachelor's degree. Like I said, there's multiple levels and areas of nutrition that you take, as well as all your basic biologies and chemistries, and then go into biochemistry, microbiology, organic, and then, multiple maths and things of that nature, as well as, if you have a liberal arts school and whatnot. But so then you can move on into what we're required with in 2024. You will also be required to have a master's degree, and that can be specialized in anything that you would like. But as of right now, you need a bachelor's degree in nutrition of some sort, and then you go through what is called the match process the spring of your senior year of undergrad, and that is kind of explained to people a lot like the residency match program. It's a bit of a numbers game. You apply and rank your schools depending on how many that you decide to apply to. They rank their applicants, and however you match up is however you get placed into a dietetic internship. For all my dietitians out there, high five if you made it through this. This is one of the most stressful things that a dietitian has to go through. You're just kind of up in the air until you figure out where you matched, and the match rate is very low, less than 50%. So schools are looking at your extracurricular activities. They're looking at your experience in the community. They're looking at your interest in nutrition. What are you doing outside of the classroom, as well as your grades. So looking at all those areas, you have to have letters of recommendation. So a lot of people are shadowing dietitians in the areas of, clinical dietitians, school dietitians, food service, outpatient, inpatient, community. There's a multiple different areas that these folks are working in the field of nutrition. And then once you match, if you match, you go through a dietetic internship. There's also two options to that. You can have one that is a straight dietetic internship. You can have one that has graduate courses alongside of it. And then I guess third option, you can also have one that sets you up to achieve a master's at the same time that you are completing your dietetic internship.
I specifically chose the route of just graduate courses because I had 2 bachelor degrees heading into it, and was waiting to either specialize in my own certification later on, or to maybe do a master's in an area other than nutrition, since I already have education in both exercise physiology, strength and conditioning, and human nutrition and foods. So once you've completed that and a minimum of 1,280 supervised practice hours and having to complete different competencies under multiple areas of dietetics, we have boards. They're our registration exam that we have to take. You have to pass, obviously, and then you also have continuing education credits. And what is different with, again, registered dietitians versus other professionals in the field of nutrition, we have state licensure. We're working very hard. Many dietitians work within legislation so that all 50 states are offering state licensure, because what that does is it makes us credentialed, and it makes us a little bit more trusted, as well as respected as another facet of the health professional team. So I currently hold a license in both Georgia and Florida. You have to pay fees for that, as well as have continuing education credits for that. So just like a physician and nurse, depending on what state they reside in, they have to have licensure in that said state. Dietitians do as well. There are many dietitians who work in hospitals who are now, most of us now have, electronic medical record privileges. Some have, basic script writing abilities. We're also going into the areas of actual physical assessments, where we can place hands on a patient to assess their nutrition status. So it's much more than a weekend course. I'm not completely knocking those courses. Like I said, there's a time and a place to see someone who has an interest in nutrition. But when it comes to, really wanting to get control of your health, wanting to follow a credible source who has, scientific education, as well as someone who is trained to help you emotionally and support you emotionally. We take psych classes as well. So we are trained to advise you on lifestyle choices in regards to your health and your nutrition and wellness goals going forward. That being said, there aren't other said credentials for a nutritionist. There's multiple verification organizations, for lack of a better word, that can certify a nutritionist. That should be a red flag number one, because we have one governing body, the Academy of Nutrition and Dietetics, as dietitians, that keeps things clean, that keeps things organized, and that keeps everybody on the up and up. You can have your license revoked due to malpractice. We have a code of ethics. We have a lot more that we have to report to than some of these other folks. Same thing with, I always encourage you, if you are getting into strength training or strength and conditioning, that you go and find someone with a CSCS, an ACE background, or an NSCCA, because those folks have much more education background than just a straight personal trainer who they have varying governing bodies who you can snag a weekend course from. So it's just getting to know your healthcare provider, getting to know their education background is extremely important. You wouldn't go to a physician who didn't have a license to practice, and you wouldn't go to a nurse who didn't have, hadn't passed their boards yet. We know the connection to food in the overall picture of optimal health and wellness. So the person instructing you on something that you take part with every day, your food, needs to be someone who is credentialed and certified to do so.
You should be a little bit more passionate about that.
And the reason why I get so fired up, and it's not to be catty, but it is when you've worked so hard to have an education to properly instruct the communities that you serve, and then you have people come in and talk about cleanses and detox and pills, and want you to go basically have a cupboard in your house that looks like a GNC. That's not nutrition. That's marketing. That's money making. That's someone who just wants a career versus a passion to help those around them. So again, not trying to get catty or knock anybody, but make sure you know your healthcare provider, just like you make sure you know where your food is coming from.
And so on the panel, there was it was a very interesting, small world. There was a professional runner who also did, she was a registered dietitian and did bariatric consulting and weight management consulting. And, obviously a positive role model in her community, being a nationally ranked runner. And I happened to know her grandmother from when I lived in Morgantown. So that was kind of funny when I heard her name. It's like, oh my goodness, I know her. And so that was cool. I got to be an old lady runner with this elite runner. So that was cool. There was a neonatology focused registered dietitian, and I thought she actually gave a talk as well. And it's amazing how far we've come with premature babies. Oftentimes, babies start out with tube feeds, which is, their nutrition is directed by registered dietitians. But there's also, when babies are really premature, less than 1,500 milligrams, or 1,500 grams, I should say. They have to often get TPN, which is intravenous feeding. And, obviously somebody that very, very tiny, it's very, very necessary to have the correct infusion. And what was interesting that she presented was the source of fat that they are given really affects their microbes development, because, as we've talked about before, in utero, babies don't have any gut microbes. And so it's just after delivery that they start to get their microbes. And so depending on how they're fed, whether it be TPN and or intravenous feeding, depends on how their microbes grow. And this also has to do with blood clotting and their immune state. And so this work is just really new as far as what happens down the road, because we're just starting to identify the microbe in the process. So this is going to be a great field in the future. There was a sports dietitian that worked at West Virginia University, and you've brought up in the past as far as athletes not only fueling them for their athletic endeavors, but before and after, and kids under stress and kids not eating properly. And there's this whole weight cutting in certain athletic, gymnastics and wrestling. And so these people have to be very specifically trained on how to actually properly feed and get enough calories and nutrients in these kids. And it's crazy because, West Virginia University has grown so much. Then, when I started out, it was a school of 20,000 kids in a town that had 20,000 people. And now there are over 50,000 students, and there are dorms and apartments everywhere, and they all have fast food restaurants underneath them. And I thought, what a nightmare this is, because there are fast food chain restaurants everywhere you look, multiple varieties. These kids would never have to step foot in a grocery store. And, how they can keep these guys healthy when they're doing a lot of these, sports that require so much more. And then there was an outpatient dietitian, and she talked about a day in her life. She did a little bit of school nutrition as far as, cafeteria worked and the Head Start program. She did a little hospital, and so there's a wide variety of what registered dietitians do. There was a renal dietitian that worked with people that are getting ready to be on dialysis or that are already on dialysis because they have special needs as far as, we know if you decrease their protein intake before they go on dialysis, you can actually decrease the time. You can prolong the time before the need for dialysis. But then after dialysis starts, there's a whole new set of nutrients that these people need. So it's this very specialized field. and an extreme amount of opportunities for people to really impact people's health through nutrition. We take it so much of this for granted, but there is, such an opportunity for registered dietitians to actually make a positive impact in the community.
No, I agree. And I think, I will give a little shout out as a former WVU athlete that I think West Virginia University is on, the upper end of figuring out how to fuel athletes and the support needed. They have 2 dietitians on staff right now. They do, team educations, and I love the passion that they have because even when I was there, they only had 1, but the true focus was on not just getting you to optimal performance through your nutrition, but they also taught lifestyle nutrition tips and created a really great relationship with food that transitioned athletes from a student athlete life into just regular adulthood eating. So I just want to give a little shout out, thumbs up to WVU, go Mountaineers, but I really think that their dietitians do an incredible job with what they can do to impact the young adult athlete and then how it progresses them into their adult life.
Yeah, and then there was another panel that had basically how to connect registered dietitians and nutrition in the community. So the director of the West Virginia University Nutrition Studies program is an extraordinary individual. Shout out to Megan. And she's involved in so many things and is so passionate about children and nutrition and outreach programs that, it is amazing. I have to, the things that, again, I go back to this hunger situation that just kind of blew me away. It breaks my heart. And it breaks their hearts as well to know that the kids may not be getting enough to eat and being hungry, let alone being nutritionally deficient. So we have, there's actually a crisis in the state of West Virginia and in a lot of states where there are food deserts where, either kids don't get enough to eat or they're getting such poor nutrition that they can't grow. We know the kids' brains, your development of your brain is crucial, and your frontal lobe is crucial from, birth to age 25. And if these kids aren't getting fed properly, then, they're really at a disadvantage. And so she talked about what West Virginia University is doing as far as outreach to try to, bring programs to areas. There was a farmer's market person that talked about, people are given tokens that their tokens go further. And so they get discounts on farmers market produce. There's also an education so kids can actually learn about vegetables, learn about gardening, so they can take that home. They can learn what the vegetables are so when they see them, and just bringing farmers markets together with the community was really what a lot of this was about. There was an event planner that her main focus was connecting events and locally sourced food. So it was very impressive. West Virginia's been, is home to a lot of great farms, family farms, and, there's a lot of great produce that's raised in that area. The soil is fertile. It's a great area for, berries and apples and peaches and pears as far as fruits go. So learning what's there and making the most of it. There's a lot to learn too. We have to bring people back to their kitchen. We talked about that. People need to learn how to cook again, get away from these fast food restaurants. People need to learn about backyard gardens. The Victory Gardens after World War II were very successful in feeding people in a time of scarcity. And, I think that's where it's got to be, is to bring back food into the kitchen in the backyard. I guess, the problems that I saw, go along with our biases. We're plant-based nutrition advocates, And the one bad thing with the dietetic community, the registered dietetic community and the nutrition studies programs at universities is the government influence. Just like the pharmaceutical companies and government influences medical school, the biggest influencers in nutrition studies is the dairy industry and the big ag, beef industry and such. And it really causes a problem. It really causes bias. And just as though doctors don't really want to hear that they're biased when drug reps come to the door and drug reps provide lunch to the hospitals. Nobody wants to acknowledge that that is providing bias, which it certainly does. I think that one area in the registered dietitian community is that bias is there, and it becomes numbing. You forget it's there. It becomes part of life. And I don't think, and frankly, it's a very difficult situation of what to do with it. And, as you discussed, and I'm going to throw this into your court now, part of being a registered dietitian it also involves food services, whether food services for schools, food services for hospitals and other institutions, private industry. And that is influenced by industry and both big ag and private industry.
Yeah, so I think what I said we were talking before is in my opinion, and from what I have seen, both being behind the scenes in food service, and then not even directly involved with the food service, but at nutrition on an institutional level, is the disconnect between actual food production and food service, and then a dietitian's role or the focus on nutrition as health related. Food service chefs, you're looking more at, product. You want to make a profit. You're selling a product. You're not looking at an outcome. So I really think that is the biggest issue right now and the biggest barrier, because when in food service, and I've heard other dietitians discuss this as well, who work in food service, who continue to work in food service, is especially at these large institutions, they want to sell the food. Bottom line is your profits and your profit margin, and decreasing the amount of money it takes to produce something and then what you could charge for it. Basic math there. But when you're dealing with populations, whether it be in inner city schools like I was at, where they need to sell the food to get the card swipes for the students, and this is during my rotations, they aren't interested in having the food waste for the healthy options that the kids are not going to eat or that the faculty isn't going to buy. There's a lot of throwback on popularity of a product versus the outcome of health that it is truly placing on the population. So, I think that's the true disconnect, is food is seen, and to many chefs, and I appreciate it, there is an artistic side to a chef's work and food display, as well as flavor combining and, the artistry of creating these meals. Yes, but we have kind of connected that with these hypersaturated fatty flavors that are not true to the whole food, plant-based, promotion that we do for optimal health and wellness, disease reversal and prevention. Oftentimes when these foods are trying to be put out cheaper, it's with less desirable ingredients as well when it comes to health. So I truly believe until, even when you look at our guidelines, for, the country, the health guidelines, dietary guidelines, it's fueled by the USDA and the FDA, both which are promoting the sale of product, whether it be
pharmaceuticals, whether it be beef, dairy. You have to look at that connection. I know some people will probably tip their hats and call me a conspiracy theorist, but it's just the proof is in the numbers and in the connection. And you have to be aware so that you can be an advocate for yourself. Because are people looking for your best interest, or are they looking to sell a product? Are they looking at the products as a profit, or are they looking at the outcome of your health and well-being? Mic drop.
Yeah, and it's a real problem, because especially in situations where the registered dietitian doesn't have an option, can't take milk out of schools right now, because if the federal government's going to put money into school lunch programs, they're demanding that dairy be in there. It would be great if we could get nut milk into schools. Same way within, universities, the dairy, it's everywhere. So it makes it very difficult. And, until people are educated enough that they say no, it's going to continue to be a problem. And, it was notable, and it becomes ignored, There were talks sponsored by the American Dairy Association, and there were people there that had claimed to be plant-based that would not say no to dairy.
No, and I think the most frustrating part of that was that one of the speakers, and again, it was a fantastic conference, but the Dulaney ladies, we don't really sugarcoat anything. So the frustrating thing that was the message that I interpreted was, if you listed on one of your slides who your sponsors were, your bias was justified. So if you told people, that you were funded by X, Y, and Z, it's okay to push their product.
Yeah.
And it's like, I just can't wrap my head around how, as a healthcare provider, because I'm sorry, as a dietitian, I don't care if you're in a physician's office, in an outpatient clinic, working food service, we know that how we survive is by eating. So every bite that someone takes off of a plate during the day affects their health. You can either make it positive or you can make it negative. So I don't care if you're planning meals or planning how to reverse somebody's diabetes, you're directly affecting their health. So just by saying it's okay that you are just letting everyone know you're biased, no, it's not.
So, that was an issue. And, and we kind of giggled, just like physicians don't want to hear bad things about their health problems. And, they're sitting in the corner eating their sweet desserts and their prime ribs. We witnessed, even though the desserts on the buffet were reportedly not the correct ones, our registered dietitians were, chowing down on things that were very, very unhealthy. And again, they're human, but we have to take these things to the, again, it has to be brought forward. And that's, what I want to commend. I want to finish this up by commending registered dietitians. I applaud their knowledge base, their science. Everyone in that room was dedicated to, their perception that they want to help people. I don't have any doubt about that. But I think, we have to awaken people to bias, and we have to, I wanted to get the message across that they have the ability to change and to promote health like no other healthcare provider can. Because what you eat, like we've said a million times so far today, is, directly influences your health. And, I want to applaud them. I want to support them. I think a registered dietitian should be in every physician's office to, help promote health, help the doctor. And we all need to keep each other, focused and keep each other honest and, be at the forefront of our fields. So, go West Virginia, go Mountaineers. They're doing a lot of wonderful things. But if we're not moving forward, we're moving backwards. And so I hope that they'll continue to look at ways to better serve West Virginia and address not only the hunger, but the obesity problem. So,
and
but again,
another huge shout out to Megan Venden at WVU, who was the coordinator of this conference. I had her not only as a professor in my undergrad work, but also as my advisor, as well as a mentor. And someone who has inspired me. I mean, she is not just in one area of nutrition, she's in all of it. And she truly has a passion for educating the community and also providing for the community that has given her so much. So I think if we can take anything away from that, my little lesson for the day is, share your passion with whoever you can reach. And if something has impacted you positively, pay it forward.
I think that's great. And next up for the dynamic Dulaney duo will be the Sarasota Veg Fest in Sarasota on May the 5th.
Hot diggity. I can't wait for some Florida sunshine. Let me tell you, folks.
So, yeah, it was a little bit rough on us at 27 degrees and wind up there, but, we toughened up. But, yep, so we'll look forward to, keeping you up to date about what we're doing, and I hope you enjoyed listening to what's going on. Next up for me, I guess there'll be a couple more podcasts before, but headed out to Mendocino for my vegan sponsored by the Stanford Inn Resort Vegan Ultra out in Mendocino. So I'm going to be climbing some hills, and so I'm excited about that. But we'll talk more up until then. As far as, the local backyard farm, when I got home, I had tomatoes everywhere, tomatoes in the raised beds, tomatoes in the tower garden. I've got some cucumbers, and my oregano and basil and cilantro look great, and I've got a couple squash going and sweet potatoes going, and the peppers are going and eggplants going. So the garden is looking good right now, so I hope the summer heat doesn't get me before we get a lot more vegetables. But that's kind of what's going on here in a nutshell. So we'll look forward to speaking with you all next week. Eat your vegetables. Eat your fruit after every meal. Give your gut a rest in between. Exercise. Get some sunshine. And see you next week. Thanks, Ed.
Bye. Folks.
So, yeah, it was a little bit rough on us at 27 degrees and wind up there, but, we toughened up. But, yep, so we'll look forward to, keeping you up to date about what we're doing, and I hope you enjoyed listening to what's going on. Next up for me, I guess there'll be a couple more podcast before, but headed out to Mendocino for my vegan sponsored by the Stanford Inn Resort Vegan Ultra out in Mendocino. So I'm going to be climbing some hills, and so I'm excited about that. But we'll talk more up until then. As far as, the local backyard farm, when I got home, I had tomatoes everywhere, tomatoes in the raised beds, tomatoes in the tower garden. I've got some cucumbers, and my oregano and basil and cilantro look great, and I've got a couple squash going and sweet potatoes going, and the peppers are going and eggplants going. So the garden is looking good right now. So I hope the summer heat doesn't get me before we get a lot more vegetables. But that's kind of what's going on here in a nutshell. So I look forward to speaking with you all next week. Eat your vegetables. Eat your fruit after every meal. Give your gut a rest in between. Exercise. Get some sunshine. And see you next week. Thanks, Ed.